Hi and welcome everyone to another episode of Let's Get Vaccinated, where each week we deliver a healthy shot of science and facts. So in case you don't know me, my name is Tran. I'm a biologist and science communicator based at Columbia University in New York, and I'm the managing director for MYTHS for Science. So we do two things on the show. We answer your questions about vaccines and the pandemic, and we all learn how to effectively communicate science, because sharing science is how we keep our communities safe. So remember, this is an interactive show and we'd love to get to know you all. So please do say hi in the chat and let us know where you're coming from. And this week, our theme will be answering your questions on how to handle misinformation about the pandemic and vaccines. So please keep asking the questions in the comments. And we would also love to hear your tips and experiences addressing myths in your vaccine conversations. So please share them with us in the chat or share them on Twitter with the hashtag #VaccineBooster. And of course, don't forget to subscribe to us on YouTube, because that is the best way to participate in our community. We'll leave the link in the chat for that. All right, so for our show today, we are joined by medical student leaders from around the country. Welcome to Victor Agbafe and Jesper from our partners This Is Our Shot, and Mattie Renn from the American Medical Student Association to hear about their experiences and perspectives on the pandemic. How are you all? Nice to see you on the show.
Absolutely glad to be here.
That's so great. And so I'm very interested in this because since you are all medical students, and I got to say, it's been quite some time to be going through medical school with, this whole historic pandemic going on, right? What have your experiences been attending medical school over the last year? Mattie, you want to start?
Yeah, absolutely. So I actually took the year off starting last May. I started work as the Education and Advocacy Fellow at the American Medical Student Association. So I was between my third and my fourth year of medical school. So I had just finished up my year of clinical rotations right when the pandemic started, and got involved at Columbia. That's where I go to medical school. In the COVID-19 Student Service Corps. So right at the very beginning of the pandemic, was involved with a group of really amazing health professional students working on sort of volunteering as a volunteer workforce to try to serve our communities and to serve the people who were hurting in New York City at the height of the pandemic. Since then, I ended up working at the American Medical Student Association, thinking about sort of political advocacy conversations, talking with our members about what they've been going through. So sort of feeling like I'm a little observer throughout all of this, but I think that Victor and Jesper could speak a little bit more about their experiences since they've been in medical school throughout this time.
Absolutely. And Columbia represent, by the way, the Lions
are
awesome.
Know.
And the student corps has been fantastic. I've had my personal experiences interacting with that organizing, and so it's great to see these things pop up in medical schools. Victor, how's your year been?
Well, I think for myself and Jesper, it's our first year of med school, and here in Michigan, it's this 1 year preclinical module. So it's been really interesting because we've pretty much started med school officially 85% Zoom University. That's pretty much where all of our lectures have been. The only in-person stuff we've had are some anatomy sessions and some physical exam practice, which, I think admittedly, it's made it tougher, I think, to have that consistent in-person community, where you're kind of going through the structures of the didactic lectures. But I think the interesting thing is around this time when the pandemic began, I got involved in Biden's health policy committee, and Docs for Biden as it started up last May. And that's actually how Jesper and I got to connect with one another. We both went to college together, and we both were non-science, life science major pre-meds. I was government myself, and we didn't know each other, but through actually efforts around COVID is how we got to meet coming into Michigan.
That's great. And Jesper, what are your experiences through the pandemic?
Yes, I mean, just to add on what Victor said, I think if anything, it's felt like a greater sense of gravity around the decision to go into medical school, seeing how much suffering there has been this past year because of this pandemic. And really realizing in a lot of ways, kind of as March for Science did, how a lot of change needs to happen, not just at the individual level for what we do as physicians in the future, but at the policy and advocacy level. So really getting involved in This Is Our Shot, which is a vaccine awareness and acceptance initiative, has been one way that we've been trying to work toward that.
Yeah, that's amazing. And all of you, it's interesting that all of you have been involved in policy, right? And that's probably not every student gets involved in that. I would love to know, because in this space, with March for Science, that's our big thing, right? Is that scientists don't often get involved with policy. But really with the landscape to address injustices, disparity, you know, all of the big health problems that we're seeing at the moment, and the problems within science at large too, it's really important that we interface with policy because it shapes everything we do. So I'd love to hear from all of your experiences on like why you personally felt motivated to get involved in policy and politics. Maybe Jesper will go the other way around, and Jesper, you could start.
Sure. Yeah. I mean, I think, like I said, you know, kind of just seeing how much people have been struggling, I think, and realizing that they're struggling not because of things that are out of our control, but things that are within our control, the choices that are being made by our policymakers at very different levels of government. I think I just really felt like, you know, going into the clinic wasn't enough to try and stop that. And so that's sort of how I got involved in more kind of political facing work, but also non-political work, kind of like this vaccine acceptance initiative.
Yeah, absolutely.
I think to Jesper's point, right, on a wide scale, when we look at the way policy impacts health, it comes down to like the social determinants of health, the structural determinants of health that are really much linked to the politics, and how, as you know, future physicians, right, we hope to make that one-on-one impact, which is important, but how do we create a better structure, right, for public health, right, where people can, you know, work with dignity. So, you know, the health interventions we try to make can be more efficacious, right? And that ideally, you know, our patients don't need to see us as much, you know, in the hospitals because they're so healthy. In this particular moment, with This Is Our Shot, I think it's sort of then you sort of take the suffering, right, that a lot of communities and people faced this past year. And for Jesper and I think it's been very much linked in then how do we play our part to sort of get across to the finish line? Because sort of when it comes now to the distribution of the vaccines, that's now at the, you know, federal government with the Biden administration, along with, you know, governors, you know, and health commissioners across the nation. But there's sort of this hole here in terms of then, okay, you can develop the vaccine, you can have sort of the supply chain R&D together, but the trust, right? How do people feel like, you know, it's going to interact with them? You know, you have all these different rumors and different conspiracies and, you know, even very adequate concerns that people have about this. And we felt like, dude, this is our shot, you know, this is our moment to say, how can we use our platform as, you know, future physicians in training to hopefully, for us, speak to others in our generation and help create discussion over, you know, this vaccination process, you know, why we think you can trust it, and hopefully to use that as momentum to then tackle broader health issues in the future.
Yeah, Mattie, you made an interesting move, right? Going into the, you know, AMSA right out of school, right? How's that been?
Yeah, well, I have to say, just reflecting on what both Jesper and Victor were talking about, sort of the role that we have to position ourselves in as future physicians, interacting with the larger structures that we're a part of. I think, you know, there's been a larger movement that I've noticed, and that I think has been spoken about a little bit in the literature, that a lot of future healthcare professionals, not just future doctors, but future nurses, future social workers, are really recognizing that, just as Victor said, the larger structures that ultimately define our health are just as important as the conversations that we're having in the exam room. And figuring out how we sort of position ourselves in that space and how we affect change for social justice and for social change is really motivating, really exciting, and really important. And so I think This Is Our Shot, the American Medical Student Association, all of us are thinking about how we can work outside of the doctor-patient relationship or the healthcare provider-patient relationship and figure out how to actually create change and help the patients and help the people in the communities that we're a part of. So that's actually why I took the time off to work at the American Medical Student Association, but I could go on about that for a very long time. So I'm happy to talk about it more at some point. Yeah.
Yeah, absolutely. Thank you all for that. And actually, I'm sort of interested because this is something else that we get a lot here. Do you ever worry that your advocacy or involvement in policy, do you ever get any pushback generally from that? Do you worry about in terms of trust either with patients or with society at large? Do you ever think about those thoughts? Are you ever challenged by that? And what is your response to, questions like that? I'll leave it to you, any of you, to jump in if you have any thoughts on that.
At least I think for me, a lot of mentors that I have now, I feel like seem to receive a lot of support, right? In terms of thinking
great.
about these broader health issues, thinking about these policy questions. Now, of course, right, when you're in that one-on-one interaction, right, with our patients in the future, it's not about the politics, right? And, people have a lot of different views. People have different identifications, even if, we agree on public health and all that. But, the way things work right now, right, we're very polarized, partisan. So I think,
Right.
got to be aware of that and not try to supposedly drive an agenda. But I mean, the way I see it is I think that stuff helps to make us better future physicians. An example I'll give, I think, is like, one, if we're going to sort of, give certain prescriptions, right, for our patients to take for different chronic health issues, right, or, prescribe a certain course for action, it's important that we know about that we think about issues around like, area deprivation index, right? And, not having access to, to healthy foods in a certain area, knowing about the way that the pricing system works, both for insurance and for, pharmaceuticals, because that affects how well the type of care we can give our patients, and also the practicality of the type of recommendations that we can come up together sort of in that, provider patient interaction.
Yeah, and to jump off of that, I think I've always sort of imagined the work that I do and engage with in the political advocacy space as something that informs but doesn't define my interactions with patients.
Right.
I'll give an example of my own. I first got involved with the American Medical Student Association because of gun violence prevention advocacy work that we were doing, and was heavily involved in that work when I first started at AMSA. And was doing my clinical rotations in a very conservative area with the primary economic driver in the area was a gun manufacturer. So a lot of the patients that I was seeing were heavily committed to working at this gun manufacturer. And my conversations for them were very health driven, very related to how they're doing, and the work that I was doing in a political advocacy space, I felt was separate, but again informed those conversations that I was having with them. Yeah.
Yeah, absolutely. And actually, the interesting thing is that do you two know actually what are they've done multiple social science surveys on this, what the two most trusted professions are out of all professions that you can pick?
This is like the most fun question. Nurses, I think, is number one, and then doctors is number two. Am I right about this?
Yeah, pretty much. Healthcare workers, however you define them, particularly medical doctors, I think. And then actually scientists are up there too. And, what's the two lowest out of interest? Do you know them? Two of the most lowest. Actually, three of the most lowest. I'll give you that. Guess.
Oh no, I don't want to disparage anyone,
That's
Victor.
right.
I'm going to make you go with this.
On that one.
Okay, very diplomatic answers. They are actually politicians, lawyers, and journalists, actually. So that is interesting. I won't comment more on that. You can that's a whole nother live stream, I feel like. But I think the point of that is that I think often sometimes, and I'm coming from it from the scientific angle, is that scientists are really scared to get involved in advocacy because they worry about a break of trust. But it's actually shown that trust is maintained very high, and there's not a lot of evidence to show that, as you say, Mattie, like in your professional relationships, whether that's your providing of healthcare to your patients or whether you're looking at data, it doesn't affect your professionalism in those areas. So I think that's an important sort of myth that we try busting all the time. I'd just like to quickly give a few shout outs to people joining us today, because we have people all around the world, which is really exciting. We have Suzanne from Rotterdam in the Netherlands. We have Penny, who's a nurse in the UK. Hi, Penny. Thanks for joining us. We have Lisa from Portland, which is fantastic. We have Susie from Denmark. Thank you, everyone, for joining today. And please, if you have questions also about medical school, or what experience of medical school, maybe you're applying to medical school, leave them for us in the chat, and I'm sure our team will be happy to answer your questions today. And Jesper is back, because I hear he had a bit of an incident, but we're all good. Great to have you back, Jesper. Everything okay on your end?
Yes, there's just a big storm here and lost power, which speaks to the importance of climate change, the intersectionality of all these issues.
There we are. We love that, sort of connecting the issues, even though you're dealing with it right on the front lines right now, still connecting the issues. And speaking about the issues, so something that we've seen with COVID, right, is that the disproportional impacts of COVID, particularly for communities of color, Black and brown communities. So tell me what you are seeing on that as medical students, what you're seeing in your communities, and what can be done, like in terms of addressing health disparities, both in the short term and the long term.
So I think to that point, I think speaking from the lens of like my mother, she's a family physician back home in Wilmington, North Carolina, southeastern North Carolina. So sort of in her role, she's able to sort of see a wide swath of the population. And I think what's really important is when we think about, particularly through the lens of a lot of the patients she'll see, these are a lot of patients who are like frontline workers, right? Who are working in like meat packing plants,
right,
on hog farms in Eastern North Carolina, and often don't have access to really good insurance sources, right? And that not only is sort of the environment that they work in put them at risk, right, for different health and safety issues, but then when they need care, they have a tough time accessing it. And when we see sort of, the comorbidities, whether it's type 2 diabetes, hypertension, that have been linked, right, to worse outcomes, right, for COVID patients, both of which, disproportionately affect the Black community, we have to see, I think in the long term, how are we going to address that? Because not only is that, from a health perspective, from an ethical lens, not only what I say in terms of making sure that all people can achieve their best potential and be the best contributors for themselves, their communities, their families, and society they can be, but also from like an economic standpoint. That puts, our supply chains, getting the necessary, product supply foods around, that puts that at risk. It's also, it's really interesting, as we've been talking about, the importance of now public health moving forward. From a national security standpoint, it's a risk, because a lot of young people now that may want to serve in the military sometimes are not able to pass these physicals. And I think a lot of people in the defense community have sort of cited that as like an issue that we need to address.
Absolutely. Jesper, and Mattie, any other thoughts on how we can address disparities that we've seen played out in the pandemic to really address long-term problems?
Yeah, I'll just say really quickly, I'm plugged into kind of the Asian American Pacific Islander community here in Ann Arbor. And, some of my friends are going around to nursing homes with like large elderly East Asian communities, because I think what I kind of worry about is like a lack of like clarity about the disparities that Asian American Pacific Islander communities are experiencing, because we're all just grouped under one big umbrella. And so, like Native Hawaiians, Filipinx communities are seeing a lot of disparities. And in terms of, equity and distribution of the vaccine, I hope that there's like more kind of like granular sort of like analysis and parsing apart of kind of the diversity of like our community and, addressing that.
Absolutely.
Yeah, I think so. I am located in Washington Heights in Manhattan. That's where Columbia is located. And so there's a large immigrant population, specifically from the Dominican Republic. And thinking about sort of language barriers, thinking about access to healthcare, thinking about economic injustice, those are all things that we have to think about when having conversations about navigating the healthcare system that we're all interacting with in different ways. Some things that I think Jesper and Victor have both sort of touched on, the issues of societal injustice and structural racism influencing how individuals interact with and communities interact with our healthcare system is so challenging and a big complex issue that I think we have to think about from a lot of angles. Looking at medical education, for example, dismantling the racism that's baked into this system that we're a part of is a step in that direction of improving access and equity across communities throughout the United States and throughout the world. And that's, I mean, it takes all of us doing small things and doing big things to try to affect change. And I think what Jesper was talking about in terms of going and visiting community members in their own spaces is just one step in that as well. And again, this could be a whole another live stream. So it's hard to unpack, I can say.
Yeah, absolutely. So before we move on to audience questions, sort of one more sort of bigger picture question I'd like to sort of touch on, which could be another live stream too, I admit, but thank you for all your amazing thoughts, really insightful. In terms of, as I said, at the start, it's an interesting time to go through medical school, right? How do you think the pandemic has shaped, your perspectives, your careers, and really how you see the field of medicine going forward?
I think in terms of looking, I guess, at least even not just medicine moving forward, but even now, right? We've seen rapid adoption of telemedicine, right? A lot of the regulatory barriers sort of to that care being struck down by necessity. And sort of around those conversations, right? I think that now, we're talking about how do we make care not just from a payer and insurance source, which is important in of itself, but also at the point of care, how do we make it more convenient for patients to be able to receive access? And how do we go to communities, right, that are often left out of those conversations? And I think I sort of think moving forward, both at least for me, in terms of how I see my medical career moving forward, and also I think in the broader medical landscape, I think now this idea and the importance of public health is no longer something that's sort of going to stand isolated in like its own realm. But you realize, right, that is a center point of efficient, right, and effective care delivery in this nation. And I think a second thing that I think will be really interesting to see how it plays forward is, a lot of the structural, right, injustices that exist within our healthcare system, to even the point of delivery. Michigan medical student alum from the 1980s or 90s, a Black woman passed away from COVID at the start of 2021. And I remember, sort of in looking at the news stories that, when she was presenting with her symptoms, there was a lot of doubt cast, as whether or not she was truly sick. And I think now as those stories are beginning to come to the forefront, hopefully, we each play our part, I think, to reckon and see how can we all work to get a better place. And I think the last thing that I would say, being in this sort of medical school domain, as different as I think sort of like this Zoom university structure has been, I think we're also potentially going to think about, I think, unique ways in which, people can sort of go through the medical education process. Like you all, Mattie, at Columbia have done, and sort of, helping right directly there on the front lines. I think exploring how we can get those hands-on aspects into medical education earlier, and potentially, I think using technology to maybe lower the costs of medical education, because that's a big barrier for a lot of individuals and communities.
Yeah, I'll just add very quickly, I hope more healthcare providers start to see political advocacy as a part of their jobs, and not something where it's like, stay in your lane, you're a healthcare provider. And I'm sure you've gotten this pushback too, Lucky, as a scientist and researcher, but realizing it's a very core part of what we should be doing. Not just doctors, but nurses, respiratory therapists, all the other people who are part of our healthcare provision system. And I think this past year with the pandemic has really shown how clearly the need is for more people in STEM and healthcare to really speak up about politics.
Absolutely.
Oh my gosh, yeah, I totally agree with everything that y'all both just said. I think the importance of having a conversation about public health and having a conversation about the role that providers should take in political advocacy work is so important. I'd also say, just as a plug for This Is Our Shot and the work that y'all are doing, I think it really enforces that we must all recognize that we have a role in our communities and in our networks to stand up and push for those conversations about political advocacy and public health. Not just in the exam room, but within all of the networks that we're a part of. And that responsibility is important, and that responsibility shouldn't be forgotten.
Absolutely. Thank you so much for those thoughts. And I couldn't agree more with all of them. There's so many. We could probably stand here like listing all of them in future. But I'm so excited that, you all have these great thoughts and are going to work on them and are working on them right now, because I think there's a lot of work that needs to be done quite clearly coming out of this pandemic. I hear actually Facebook might be down at large, but YouTube is still going. So we'll have this on the replay too. So, the show will go on even if, major social networks go down, apparently. So, and we have a bunch of questions. So we should get to the audience questions right now. And, I think for these, we can do them quickly and we won't need to go around in circles. So feel free to jump in if you have thoughts, or, pass if you don't have thoughts on them. I think the thing that you were talking about is Zoom University, right? So I thought, this is a thing that y'all are going through, right? Pandemic fatigue and the effects that it has. And I guess, do you have any tips for sort of dealing with everything that's going on in the world at the moment? Because I feel like we're at that point, right? There's light at the end of the tunnel, and it's exciting, but it's also, we still need to keep going in terms of being cautious and making sure we're doing the right things as a society. So any tips, as medical students, for dealing with that sort of fatigue?
I can actually, when I heard this question, the first thing I thought of was an article from the New York Times, actually. And I just wanted I have this burned in my memory. What time is it? What day is it? What did I do in October? And why are we standing in front of the refrigerator staring at an old clove of garlic? And it's my whole life was basically summed up in that quote. The experience of living through the pandemic and this strange sort of time warp that we're in is not to be underestimated. And I think finding ways to maintain the communities that we're a part of, whether or not that means continuing to be on Zoom calls or social distancing in a park that's close by, is something I think is really important. Also, finding ways to take care of our mental health and to engage in that for myself. Regularly seeing a therapist. For others, that might be even just talking to people who are close to them and talking through the issues that are there. Those are a couple things that I can immediately think of. But I don't know, Victor and Jesper, if you have any other thoughts.
I think the big thing, and I think you already covered a lot of it, is in that wellness realm. At least what's worked for me is just in a socially distanced way. Spending time outdoors in nature, going on runs. Prayer has been a big part, sort of wellness, and to think about the big picture and why we do what we do, what's our sense of purpose there. And then I think the second part, and I think a big blessing in some ways, at least for me in this pandemic, has just been more time with family. So we were completely remote here in Michigan from mid-November through the start of March. So I was completely back in Wilmington, NC, completely on Zoom, and just the time to go through the grind, interact with the parents when they're back from work in the evenings, spend time with the siblings who are in college. It's created some just great moments, conversations, chances to get closer that I'll definitely relish post-pandemic.
Absolutely. Here's something that is really important, and I've actually heard a lot. Andrea says, my sister is an ICU nurse and has PTSD. Any recs for mental health support? And I know this is a big thing. It's been a tough year for healthcare workers, particularly on the front lines of the pandemic, to wondering, and I know a lot of universities have programs, Columbia has programs for this. Just wondering in general if you have sort of any resources you could sort of point to for healthcare workers during this tough time.
Yeah, I'm aware of the Physician Support Line, which is a really amazing organization that was organized by practicing psychiatrists who basically opened up the phone lines to have conversations with any healthcare providers who need a listening ear, which I think is a pretty powerful organization to work with. And I think another important group that doesn't necessarily provide mental health support, but that does work a lot in the advocacy realm, is the Dr. Lorna Breen Heroes Foundation. It's been doing so much work advocating for mental health support for all healthcare professionals after the passing of Dr. Breen at the beginning of the pandemic. And then also like getting plugged into licensed medical professionals. I know it can be really tough in moments like these, but I know a lot of institutions have been pushing for it, just like Lucky said, at Columbia and at other universities. Yeah. Those are a couple thoughts. Again, whole other live stream.
It absolutely is. And I think this is an area that has gotten more attention to, and I'm glad to see that these efforts are being sort of thought and brought out more intentionally right now, because they are so critical, and it's something I think that has been revealed by the pandemic. So thank you for those tips. Annette says, and I sort of feel this way, I think I have the opposite. I have opening up too soon anxiety. Thank you for that comment, Annette. I think I feel you. I have both at the same time, which is, the pandemic is complex. It's quite normal to have these thoughts, I think. And I guess the main theme that we were talking about today is misinformation, which is quite interesting. As you're going through medical school, you're learning about this a lot as well. I'm just wondering, I guess before we get into the questions, have you experienced anything in terms of misinformation campaigns, anti-vax campaigns, or anything like that as medical students? And I guess generally, how can we, what is our responsibility in terms of dealing with them and making sure people get, good information so that they can make health decisions?
Yeah, I'll hop in there. So actually, Victor and I got an email about a month or two ago from Robert F. Kennedy Jr.'s anti-vaccine organization.
Oh, wow.
Promoting promoting this documentary. I'm not going to say the name because I don't want people to go look for it.
I think I know what you're talking about.
Yes, and I was just Victor and I, a lot of med student groups at Michigan got this email, and we were just kind of shocked. Like, how did they find us? Why are they sending this? Why are they trying to capitalize on kind of a lot of real fears and like frustrations people have about, racism, for example, in medicine, but for like a bad cause. And so I think that really kind of showed the importance of engaging and creating platforms just like this one that you're leading, Lucky, to let people in our own communities know more about what the vaccine, what it is, the fact it's very safe and effective, that there are side effects, but for the very most part, they're not severe, and that they're kind of what we need to get back to a normal life, like seeing our friends again without masks when everyone gets vaccinated in the future, or, not losing our loved ones to COVID because, they're sick. And so I think really trying to find ways that we can approach those conversations empathetically, acknowledging the real hesitation people have, but also pointing them to good resources as well.
Yeah, absolutely. So let's go through these questions. That was a great start, Jesper, for sort of setting the scene. Thank you to the audience for all these specific questions. I think we can sort of shoot through them. I think a lot of them will have similar answers, but I think it's great to sort of see where all of you are having these conversations and maybe hitting some roadblocks in your conversations with your community, because we're learning together, right? We're learning how to have these, empathetic conversations. And I think that's where we're at that point where, like, I guess the vaccine is starting, not to everyone, it's starting to open up to everyone to be eligible. And so it's critical to be having these conversations now. So yeah, something that I see that I think this is a great question and that I see a lot is, how can you correct someone without sounding like a know-it-all, right? That's so important, right? Because it is about listening, right? So maybe some of you can sort of share some tips on having these conversations where someone is sort of worried about the vaccine and bringing up a, factually incorrect thing. How do you sort of handle that conversation?
I can jump in really quickly, and I would say practice, honestly. I think sometimes one conversation might not go all that well, but that's an opportunity to learn for the next time. So if I know that doesn't totally answer the question, Gabriella, but I think sometimes figuring out like the specific language that might be used for a specific question takes an accident or takes sounding like a know-it-all once or twice. Victor and Jesper, I don't know if you have more to add to that, because I know I was pretty vague.
I think just a few frameworks that come to mind, I think, from experience is just one, right? Like, and you mentioned this already, Lucky and Mattie, like listening, right? And understanding where the person's coming from, seeing, you know, one, like, what are their concerns, but also, you know, what is their like incentive structure? So I go to that, right? A lot of the pushback against some of the public health measures, right? Some have come from like, you know, the small business communities, and like, you know, you even see it here like in Ann Arbor, right? Some like restaurants that have like gone out of business. And I think being able to engage with somebody, right, who's coming at it from like that standpoint, right, who this pandemic has, you know, really hurt their livelihoods, is something that's really important. And I even think more broadly going to, you know, how can we sort of advance shared public health goals? In early 2019 in North Carolina, I had the chance to meet the Surgeon General at the time, Jerome Adams. And he sort of said, you know, as a call to all of us in the public health community is we need to sort of frame our goals in terms of how it supports the goals of like other stakeholders. And he mentioned how in a really rural, more conservative community, when they were sort of promoting an anti-smoking campaign, they framed it sort of as a fire prevention campaign because, you know, wildfires were an issue in that community. So I think the framing is also a very big part of things.
Yeah, I love that. Here's a question that we're getting a lot, particularly in light of the mRNA vaccines, right? How can we assure people that the vaccines are safe, even though they are new? I think this comes up a lot, and it's a big part of the trust thing right now. So what have you been telling people in terms of your conversations on this?
Yeah, so I would also love to hear your thoughts, Lucky, because I know you've probably read a lot about this too. But really, like, the way I think about it is that, yes, the process has been pretty remarkably fast in terms of the creation of a vaccine, but I don't think there's ever been such scrutiny as well of the whole process of ensuring that diverse populations are represented in these clinical trials, in ensuring that, you know, there aren't severe side effects that can be damaging to people in these vaccines as they go through these trials. And so, although it's very fast, the way I kind of say it is that I think that there's never been a time where, you know, all of us, you know, our regulatory bodies, just people in general, have been really paying attention to the safety and efficacy of this vaccine.
Yeah, absolutely. And what I want to say, that's a great answer. And what I want to say on that is that it's okay to be sort of curious because it's sort of new technology, right? And I'll tell you from the perspective of scientists who worked on similar technologies, I, with my personal choice, have been the same, right? It's just like I've been following the science really keenly, and I'm going, how is this? And, you know, when it came time to choose and sort of figure things out, I also asked those questions in my mind. So it's a completely natural thing to do. We're not asking anyone to sort of go, here's science, just believe it, right? I think that's really what science is that we ask questions, we work hard to make sure things are safe, and we work doubly hard to make sure things are safe. And so that has gone through a very rigorous process. And as you say, Jesper, it's even more rigorous than ever before, I feel, because it's such a large issue in the world. And I guess the other thing with addressing that they are new, it's really, you know, mRNA vaccines, they are sort of new, but it's also built on, you know, technology that at least has been worked on for a couple of decades. And then when you think about vaccine technology in general, which a lot of the same principles are in terms of, you know, generating a protein that triggers an immune response, that's been around, you know, for a long time, for a century, right? And it's been remarkably successful. And there have been very, very few incidences where, you know, the vaccine causes, none really, more harm that have been approved. That is more harm than, what they are trying to protect you from. And so I think when you put that in the bigger picture, I think those are important things to understand. But I think that is a great question. And I think the big thing for me is just that that's a normal question to ask. And we should definitely, as you all say, we need to be listening out for that. That's really great. In terms of, I guess our peers, what about, young, healthy, low risk individuals? Why should they be vaccinated? Are you having some of these conversations with your peers who are sort of going forward and not really making the vaccine a priority? Is this something you're sort of talking about at the moment? Thanks, Mallory, for the question.
I guess at least within my circles, right, being within medical school, I think at least here, there's been a pretty wide consensus on the importance of getting vaccinated. But I think, right, like in broader conversations, I think a big thing that's really important is that even if, you're not you don't show symptoms, right? And needless to say, not serious symptoms, as youth, it's possible that we can spread it, to our parents, to our grandparents and other loved ones and friends who may be a lot more vulnerable. So just even, to play our part to help keep our community safe, really important as young people to do that. But also too, there are young people, right, who have comorbid conditions, who may have different sorts of conditions that compromise their immune system, that can still make them, pretty high risk. So just because, we're young, and even if you're healthy, while managing those conditions, it's still important that we take precautions.
Yeah, absolutely. And I think there's something that I feel personally isn't discussed a lot, and it's sort of different, like long COVID and the effects. So we're not just talking about hospitalization and death, which I understand why the news focuses on that at large. But for it's different just looking at population health and an individual, because the impacts of having long COVID, even if it's considered broadly as a small issue, it's not a small issue. It means a lot for you, and it means a lot for your life. And so I think it's important. So that can include young, healthy people and protecting your community. And so it's important that, we participate in vaccination to help protect everyone as much as possible. With public health, we want as many interventions and layers of protection as much as possible. This is a great one, so we should feel great about taking it. Chris, actually, this is a good comment on the last one. Remember, mRNA vaccines have been researched over 15 years, ditto for vaccines for coronaviruses. Yes, that's absolutely right, Chris. Thanks for your comment. Oh, here's one from Amy on YouTube. How can I, as a patient, talk to healthcare providers who have vaccine hesitancy? That's an interesting one. Have you any ideas for that? Because actually it is, I'm not sure about providers, but I definitely know there are people who are vaccine hesitant in the healthcare community. And I know that's something that we are working on as an institution. Any tips for that?
I think that's a really interesting question, just like Lucky said. And it kind of flips the conversation on its head a little bit. And I think that's also really valuable. This is a little bit like a broken record, but I would actually hearken back to the idea of listening and empathy, and identifying in the context of a conversation why a person is specifically hesitant, and then bringing the conversation forward from there. Because I think that, honestly, there are perfectly legitimate reasons why people might be hesitant to get the vaccine or interact with a larger social structure or institutional structure that has a history of violence. And so thinking about, and those are just sort of things that come up to my mind, but someone who I'm having a conversation with might have many other reasons to be hesitant. And initiating the conversation from a place of shared humanity, a place of empathy, and a place of humility, I think is the most important thing to do. And that doesn't matter. That perspective doesn't matter if you are a doctor, a nurse, a social worker, a patient, a family member, or anyone else. That's how we should all be initiating these conversations. And I said all those things, and also scientists as well, of course.
Absolutely. Thank you. That's such a great question. Sort of related from Melanie. I'm an employer and I have some employees who are vaccine hesitant. What's the best way to encourage them? I'm guessing sort of similar answer for this one, right, everyone? Yeah, that'll do. I think the one thing that I will add to that is that apart from conversations are important, and the great thing about conversations is I do think that active listening and having empathy and hearing concerns first, that's such a basic thing that applies to many situations. So I think on March for Science, what we're going to do is do trainings on how to have these conversations with This Is Our Shot. And I think once you learn them, you can apply them to many situations. So I think that's the great thing about this. One thing with employers, if you're an employer, I think another thing is access too. It's not just, hesitancy, it's also access. And so one of the things that is a barrier, particularly for working class communities, communities of color, is not having time off to go, it's like voting in many ways, to go and get your vaccine, right? Particularly if it's at a weekday and you don't have a lot of choice on the time, right? So I think making sure you let your employees and let them know that they can go and have time off, paid time off, to go and do this thing that is important for your business and important for the community. I think that's a great thing that you could do. Here's an important one that everyone is discussing a lot at the moment. From Scott, what efforts are being made to alleviate vaccine hesitancy, especially among Black and Brown and other marginalized communities, and how do we counter vaccine resistance? This is from Jolyn, in marginalized communities.
I think two thoughts sort of come to mind here. I think one of them is what This Is Our Shot is engaged in, right? Is sort of having individuals who come from these communities, right? Not just within medicine in and of itself, but in other realms of science and other professions, to sort of be able to openly discuss and dispel, right, different myths that we may have about this, right? And to talk about these different healthcare issues that even exist pre-COVID. I know for Jesper and I, a lot of discussions that we've had with other groups, be it SNMA, APAMSA, LMSA, different student groups that represent different marginalized communities. A lot of that focus has been on, how a lot of these discussions over health disparities have been happening within these communities even before COVID. So I think one, that's space for acknowledgement. And I would say two, a lot of the discussion has, I think, sort of focused on resistance within these marginalized communities, but I think a lot more energy, I think, needs to go to the point we actually brought up in the previous question, which is access. I think when the information's put out, there's been a pretty general consensus in wanting to take this, but how do we make it more seamless via policy and advocacy to make sure that federal government, state government, private sector, how they're working to get it, that somebody doesn't have to take time off of work, that doesn't have the flexibility to do that to get this vaccine, right? To make sure that a lot of times when we're delivering it through healthcare systems, that your federally qualified health center is able to get access to vaccines on equal footing and scale, just like a large academic center like University of Michigan or Columbia can. I think that's the bigger barrier that should be focused on right now.
Yeah, I could not agree more, Victor. Just to what you said, especially your second point, I think shifting the conversation to think about vaccine access for marginalized communities is very important. I would also say, highlighting a couple of other organizations that are doing really amazing work. We Got Us, which is organized by Lash Nolan and a bunch of folks in Boston, who are really focused on providing information rather than persuasion or paternalistic conversations, with community-based organizations that are embedded in communities that have pre-existing relationships with folks who have questions and have very legitimate questions. So I think that's another thing to throw into that. But I think, Victor, totally agree with what you've said.
Yeah, absolutely. I can't thumbs up enough to all of that. I do think, I've been concerned about this conversation because I think sometimes you can put stigma on the communities, who you think you are helping. And I think that's the problem with this conversation around vaccine hesitancy is this community, and that can have implications. Whereas often it is access. It's similar again to voting, right? It's hard to access these services or rights, and we need to work a lot more on that. And and it's actually interesting. I'm sort of seeing the polls right now, and really, I think something to bring up and to remember, it's actually Black and brown communities who are most concerned about coronavirus, much more than white communities are. Those are shown in polls over and over. And in terms of people who said they were waiting and see if they'll get the vaccine or not, over time, it's actually Black and brown communities who are getting the vaccine. So even though they had concerns, rightful concerns because of systemic racism and, historical reasons as well, that those communities are actually going to get vaccinated. And there's actually other communities who are sort of more along political spectrum, which is another episode, but is interesting, are actually not budging. So that's interesting as well. I think it's such an important conversation. One last question before I let you all go. So amazing to have you here and all your insights. It's been really wonderful, and I'm sure our audience has appreciated that too. So sort of ending where we sort of started, in terms of how do we effectively communicate with / educate conspiracy theorists or anti-vaxxers? I think that's an interesting, we were talking about, sort of anti-vaxxers, and their targeted campaigns at the start. So what if it's someone that we know, a loved one or someone in our community who is listening to these theories? How do we communicate with them? Because they can be hard to budge sometimes, right?
I think it's just realizing that change doesn't necessarily happen over one conversation. Having the patience and humility, like Mattie said, to be persistent, especially if it's someone you really care about and you really do hope that their mind will change. And if you're thinking more broadly about anti-vaxxers in general, or kind of the anti-vaccine movement, and you want to kind of work towards building vaccine acceptance, you should check out This Is Our Shot, thisisourshot.info. To see more about how you can work toward that in a lot of different channels.
Absolutely. And I do think that that's important, is that one thing I will add to that is I think shared values are really important. So, sometimes people will believe conspiracy theories, but that's not because they're not educated. It might be because they might have a political or a background which makes them more susceptible to certain messaging from anti-vaxxers, right? And so maybe they care about the economy, or they care about, personal freedom. There are actually great reasons why vaccines, getting the vaccine and getting everyone vaccinated is helpful for those two things. So I think thinking about shared values and beginning where the person is standing at is really important, rather than just throwing facts at them. So that would be my one little tip for that. All right. Thank you so much to everyone for their questions this week. And thank you so much, Mattie, Jesper, and Victor, for joining us today, for your wonderful, wonderful insights. Before I let you go, can we go around in a circle and sort of, if you want to plug or have any closing thoughts or messages, to sort of let everyone know? Mattie, maybe we could start with you.
Yeah, absolutely. Well, first of all, thank you so much for having us here and giving us a space to have these conversations. I think, opening up the floor to have these conversations is definitely not just the first step, it's so many steps along the way. We were having this is kind of an aside, but we were having a conversation before about the intersection of structural racism and climate change and environmental health, environmental justice. And so this is totally unrelated to vaccine, well, very related to vaccine uptake. Earth Day events across the country are happening, and having conversations about environmental justice and climate change in the context of COVID-19 are so important. So just hopefully everyone's getting involved with Earth Day stuff this year.
Yep, definitely connected. That's our plan here at March for Science. We've got a whole Earth Week program, which I'll let you know later. So thank you for that, Mattie. Victor, any closing thoughts or things to plug?
Absolutely. Thank you so much, first of all, for sharing your platform with us, Lucky, and for the work you've been doing constantly here to elevate these conversations. I think the one thing is, going on over a year here in Michigan, seeing cases rising a lot. We're getting a lot of email notifications, hospitals overwhelmed. It's quite concerning. So I think the biggest thing is, let's have empathy for one another. Let's stand together, it can be a rallying cry, to unite us in many ways. Let's get to that finish line. And, this is our shot to a lot of youth out there. This is a movement where, I think joining us could provide you an opportunity for us to be a part of sort of having these conversations, right? At your local school, right? Within your communities and within your families. And last thing to me is just also that when we move beyond this pandemic, these different conversations we're having, right, over, costs of care, over, disparities in care. I think the positive sides, right, and how we've been able to develop this vaccine, the successful in many ways, could be improved, but in many ways successful deployment of it, I think should give us a lot of inspiration and momentum for us to strive higher, to then start to hit at these other really important healthcare issues. Because we've seen now that when we put the resources towards something and we prioritize it within the healthcare realm, we can get a lot done. So it's time that we do that with an eye on other chronic healthcare issues, issues of access, disparities, and prejudice.
100% well said, Victor. Jesper, any closing thoughts?
Yep, I'll just say, thank you so much, Lucky, to you and March for Science, your amazing advocacy on these issues. And, if you're someone watching today and you are excited to build a COVID-free world, just like the rest of us, please join This Is Our Shot. You can go to thisisourshot.info, and we're a movement of healthcare providers, scientists, students who are working through social media and our own communities to kind of have these conversations about the vaccine that are really important.
All right, that's awesome. And yeah, thank you to our partners, This Is Our Shot, for being a regular feature on the series and for all the work that you do as well. So thank you all for joining us today and for your amazing, insightful thoughts. And good luck for the rest of medical school for those of you who are early on, and good luck for the rest of your careers as well. And I'm sure we'll be speaking again very soon. Thank you so much.
Thank you.
All right. Now onto this week's Fauci fave.
My favorite.
So now, to state the obvious, these obviously aren't endorsed by Dr. Fauci himself. These are great examples of great public health messages inspired by Dr. Fauci because he's such a talented communicator. And here is this week's example.
In the Big Ten, 9th nationally, the sophomore from Kansas City, top score of 14.75 against the Buckeyes.
Same vault as Diab. Oh, and he sticks a landing. Not sure what that is.
I think it's vaccine.
Vaccine card? Whatever it is, if that's what it takes, sign me up for one of those cards. That was amazing.
So that's quite some flex, right, you're all? But it's all good because we should all be beaming with pride once we've been vaccinated, and we should want to tell the world, right? So kudos to Evan. Kudos. That was amazing. And while we might not all be able to do backflips to encourage vaccinations, we can all learn how to be effective science communicators and learn how to have effective conversations with people who may be hesitant about getting vaccines. So please sign up and join us during Earth Week on April 21st for our big first vaccine booster training. Here at Much for Science, our expertise is bringing together science and activism. And we are going to teach you how to use tried and trusted techniques from both worlds in science communication and in relational organizing and combine them together to help get out the vax. So yes, please, the link is right there and we'll drop it in the comments as well. But please join us because right now, as the vaccine is starting to open to more and more people, it's important that all of us play a role and all of us start having those conversations with our loved ones and with our communities. All right, so thank you so much to everyone for joining us today. Don't forget to subscribe to our YouTube channel and to keep participating in this community. And remember, boosters, facts save lives. Please stay safe, and I'll see you all next week. Bye.